Yes, so I've been going in, speaking to companies, just giving people a general kind of introduction to mindfulness and how it relates to mental health. And, it's Mental Health Awareness Week, but, when you practice mindfulness, I mean, I've been doing it for 20 more than 20 years. Every day is Mental Health Awareness Week because you're sitting down to observe and notice what your mind is doing and your emotional state and your physical state every day. So you're maintaining that awareness, So we're being kind of reminded that we need to take more care of ourselves. But so I mean that's what I'm doing. But also obviously with mindfulness, there's lots of kind of techniques and practices and methods to help you maintain that kind of positive mental health.
What do you think? What does being mentally healthy mean to you then?
It's a good question. So the reason I started practicing when I was 17 was because I wasn't mentally healthy. And so I had anxiety, I was depressed, there was a lot of pressure, I had no perspective on anything. I felt like I was kind of trapped, not just trapped in my own head, but trapped in a situation, trapped in circumstances. So there was a sense of stuckness. I couldn't stop thinking. I was offered medication, as is normal by my doctor. But, growing up around Buddhism, I kind of had this sense that, well, surely there's something I can do. It's my mind. It's my body. These are my thoughts. Surely there's something I can do. And of course I was right. And what I started to do was sit with it. Every day, sit with it. So mindfulness it's not something soft and fluffy that's going to make you feel good. I mean, it does sometimes, but it's just about being able to put your mind down and take a look and notice and not join in. You don't have to join in with every thought. You don't have to join in with every urge or habit or impulse. You don't have to join in with your emotions if you don't want to. You can take a step back from all of that and realize that when you do that, it's a completely different experience of yourself. One that's much calmer. So basically, I went from having poor mental health, which felt very divided and fragmented and chopped up. I was at war with my own mind and my own body, to a very kind of positive mental health. Mental means mind, health means whole or one. So mental health for me and my experience is kind of like there's no division anymore within myself. I don't feel like I'm apart from my thoughts or my mind or my body. One of my favorite Zen masters, Dogen, medieval Japanese Zen master, he says enlightenment is when you realize that you're the same as the moon and the stars and the trees. And that's very much how I feel now, is that I'm not apart from anything. So I went from a sense of fracture and smallness to a sense of largeness and feeling very much kind of plugged in and part of everything.
I just want to ask you a question that was raised when I was doing the introductory piece with Stu, which some listeners may have heard. And Stu said that he struggles with this notion of having a specific mental health awareness week and all these high profile names talking about mental health issues, because he wonders if that perpetuates it in some way, and that actually, these are Stu's words, people should be told to man up and get on with it. And actually a texter, is that all right?
Yeah,
We'll call him a texter, has texted to say, I agree with Stu's view on some of the mental health claims. We need to remember the issues that some had to contend with during the Second World War. And that notion of the stiff British upper lip, that sort of notion during the war is, I think, very prevalent among some generations. The idea that they really did have a lot to contend with. And I just wonder what your thoughts are on that.
Yeah, well, it works because in a situation like World War II, you've got no other, you can't indulge in, you have to get on with it. Stiff upper lip works in a survival situation. But, then you get all the soldiers with, post-traumatic stress syndrome and things like that, stuff they carry with them, stuff they can't talk about, the stuff that eats them up inside. I always say that mindfulness, the most difficult thing you will ever do is sit down with your own mind. That you can climb Everest, you can jump out of a plane with a parachute. The most difficult thing you will ever do is sit with your own mind. Now, talking about manning up, that's kind of manning up. It's not about kind of soft and fluffy feelings and things like that. It's, can you sit with your own mind? Can you? Can you sit with fear? Can you sit with worry? Can you sit with anxiety and not join in so that it just starts to fall away in your experience? So I work with people who are sitting through things you cannot imagine you are able to sit through. You think, well, you'd have to just escape, or you'd have to just... No, they're able to sit. Sometimes I say they're able to sit in hell and not mind the flames. Now, who can do that? Now, I know people who can do that because I work with them. I'd like to say I can do that. I can say that you can do it given the right pointers and training. So to me, that's manning up. It's not, it's just able to kind of sit with ourselves and stand on our own 2 feet.